are you doing today?
Hi, fine, thank you.
My name is Tammy. I'm a student nurse practitioner. Are you familiar with practitioners at all?
I am.
Yeah. And what? How would you like me to address you?
Joe.
Joe? Okay, nice to meet you, Joe.
Thank you.
So what brings you into the clinic today?
Well, I've got this long-standing pain in my joints, mostly my hands and my knees.
Okay. How long has this been going on for?
Oh, several years.
Several years. Tell me a little bit about this joint pain. How does it feel?
Well, really, when I wake up in the morning, I'm very stiff, mostly, in my joints from my hands, knees, and then, but then, it gets better when I rest, and just to touch my joints, it hurts.
Okay. Do you notice any bone popping sounds or crackling sounds
in my
your
knees?
Joints? In your knees. Okay. Now, do you feel like your knees and your hands, your wrists, do they feel weaker?
In my hands.
Just in your hands. Okay. Now, how would you rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever?
I'd say a 5.
A 5, okay. Is that currently at a 5, or is it 5 at the worst time?
5 right now.
Okay, okay. You said it does get, worse at times. When it does get worse, where would you rate it? What's the highest?
Probably a 10.
Okay, okay. Have you noticed any enlarging or swelling in certain areas at certain times of the day?
Yes, my hands especially.
Okay.
And then during the day, it's just, as the day goes on, it worsens.
Okay, all right. Have you been taking anything to relieve the pain?
Tylenol and ibuprofen.
Okay. Do you feel like that's helping at all?
No.
No? Okay. All right. Any allergies to medications?
No.
No. Any latex allergies?
No.
Penicillin allergy?
No.
Nothing in the environment?
No.
No? Okay. So you said that you're taking Tylenol or ibuprofen for this pain. Are you on any other kind of medications?
No.
No? Okay. Any past medical history, like hospitalizations, surgeries, injuries, anything like that?
Yes, I broke my right elbow when I was 10, and then I had a surgery when I was 16 on my right hip.
Okay. That's pretty young. Were you a very active child?
Yes. I played professional football in my 20s.
Wow, wow. Do you still engage in any high-impact sports?
No, I just like to play golf on my free time.
Do you feel like the symptoms you're having are interfering with your golf game at all?
Yes.
Okay. Let's see. The family medical history. I'm just reviewing your chart here. It says that your father is 85, he's alive, and he has a history of emphysema, hiatal hernia, and he also has arthritis. Okay.
That's right.
All right. And your mother, she passed away at 32 in a motor vehicle accident. Is that correct?
Yes.
Okay. You also have a brother and sister. Any medical history with them?
Yes, my brother has high blood pressure. My sister's obese.
Okay. What about some social history? It says here you're married. How long have you been married for?
30 years.
30 years. Wow, good for you guys. And you're employed as a truck driver right now?
Yes.
Okay. How long have you been doing that?
Well, ever since I retired from football.
Okay. All right. Do you feel like this pain is interfering with, you said it's interfering with your golf game. Do you feel like it's interfering with anything else in your life? Your work?
Pretty much everything I do, from my sleep to my work, any sports I do.
I'm sorry to hear that. That must be tough. Do you use any cigarettes or tobacco products?
No.
No. Do you drink?
No.
No. And no alcohol?
No.
What about any recreational drugs,
No.
such as marijuana or anything like that? No? Good, good. So I just want to go over a couple of things, just a review of systems, okay? Are you feeling tired at all? It says that it's kind of interfering with your sleep. Do you have any, are you tired during the day? Do you feel like you're getting enough? It's just interfering, or?
I'm not sleeping very good. I guess I'm a little tired.
Okay, all right. What about, do you have any, like you said you have some swelling. Do you notice any redness or anything like that in your joints? No. Any hot temperature changes? Do you feel like it's hotter?
No.
Do you feel like you can't move it as well? The range of motion, is that decreased at all?
I would say definitely it's stiff.
Okay, all right. What about mentally? Do you feel like you're drained or depressed or anything like that? No. Okay, all right. What about, you said they're pretty stiff and they're painful when you move them. What about at rest? Do you feel like it's better at rest?
Yes.
Your joints? Okay. Do you feel like, now you also said that you have some tenderness, they feel swollen, and you have some crackling in your knees. Any crackling anywhere else that you notice? No? Okay, all right. So what I want to do next is I want to do a physical exam, check out those joints that are bothering you, okay? I see the medical assistant was in here and she took your vital signs, okay? Everything looks pretty good on there. Your weight is a little bit on the higher side. Do you get any exercise besides the golfing?
No.
No. What about your diet? What's your diet like?
Well, I eat a lot of fast food because I'm a truck driver.
Okay. Now, do you feel, when you get up and walk around, do you feel unsteady, lightheaded, dizzy at all? No? Okay. All right. I see that they drew some labs also. Some of that is pending. So I'll check back and see if I have any of those results, okay? Do you have any questions before we get started?
No, thanks.
No? Okay. Well, then I'll have you go on the table, okay?
Okay.
Put my hands here, and then I'll look you over. Now, during this exam, if you feel lightheaded, dizzy, if I'm doing anything that's painful, anything like that, or have any questions, please let me know, okay? Okay. All right. So I see that, you had a little bit of hesitation climbing up onto the table. Did you have some pain with that, with moving on the exam table? Okay. All right. So first thing I want to do is I want to listen to your lungs and your heart, okay? I do that on every visit, just to make sure that everything sounds okay. All right, so usually I have my patients in gowns. However, I'm sorry we don't have anything available, okay?
Okay.
Okay, so take a deep breath every time you feel my stethoscope. There you go, in and out, nice and deep. Okay, now listen to your front. Nice deep breath, in and out. I'm just going to listen to your heart. You could breathe normally for this part, okay? Just listening with the other part of my stethoscope. Can you lean forward for me? Good, okay. Now I'm just going to listen to the blood flow in your neck as well, okay? All right. Any stiffness in your neck that you're feeling?
No.
Okay. So I just want to ask a couple of questions just to check your mental status. Can you tell me your full name?
I'm Joe Williams.
Can you tell me your date of birth?
9/28/52.
And can you tell me where you're at?
In the doctor's office.
Okay, good. All right, so I want you to do a couple of things. Can you puff out your cheeks for me? Good. Can you lift up your eyebrows? Good. Can you smile for me? Good. Any pain or anything with that at all? No? Okay. Can you lift up your shoulders? Can you touch your ears to your shoulders? Good, good. Okay. So, can you squeeze my hands? Good. Can you go like that? Push towards me? Good. Pull towards yourself. Same with your legs. Can you push towards me? Pull towards you? Good. I'm just going to check for any swelling here in your lower extremities. Any pain when I touch down there?
No.
No? Okay. I'm going to check your pulses while I'm down here too, okay? Okay. Can you squeeze my hands? Good. Can you, before I have you do anything else, I'm just going to feel for your pulses too, okay? All right. Can you straighten out your hands for me and flip them over? Okay. Can you make a fist? Good. Can you put your hands like this and then kind of flip them down a little bit? Any pain at all when you do that?
No.
No? Okay. I'm going to take a peek at your ankles too. Does it hurt at all when I move your ankle?
No.
Any certain way? What about this one?
No.
All right. I'm just going to take a peek at your knees. Any pain when I touch your knees?
Yeah, a little tender there, and
Okay.
and now my wrists do hurt.
No, they're hurting a little bit after that activity. Okay. Can you bring your knee up to yourself a little bit? Good. And your other one? Any pain with doing that?
Yeah, a little sore.
A little sore. Okay. What about when you move them from side to side? Does it feel sore at all, your ankles?
Yeah.
Okay. What about your knees? Are you able to rotate your knees a little
Yeah,
bit?
but they're pretty stiff. They're sore.
Okay. All right. Can you bend them for me again? I just want to feel. Yeah, there's a little bit of crackling in there. Okay. What about your elbows? Do you feel like...
Yeah, they're pretty sore
Are they
too.
sore? Just want to check your reflexes here really quick too, okay? I'm going to check that. Check your ankles there. I'm going to check your elbow. Just relax your arm, okay? And relax this one. Okay, I'm going to check your wrists. Okay. So now how do your joints feel after that activity?
They're a little sore.
Okay, all right. I'm just going to check for some swelling up here as
Okay.
well, okay? Just relax your arm.
Okay.
Just going to feel for any lumps or bumps. Does it hurt at all when I touch?
No.
No? All right. I'm gonna
Just
check
right
this.
on the joint it does.
Just right on the joint. Nothing here in this area? No? Okay. All right. So what I want you to do right now is I want you, if you could just stand up for me.
Okay.
I want to check your spine, the bones in your back.
Okay.
Okay. So what I'm going to have you do is I'm just going to step right behind you, and I want you to bend over. Okay. Go ahead and go up slowly. Good. Can you stand up just how you normally would stand? Okay. All right. Do you feel unbalanced at all right now? No? Okay. You can have a seat.
Okay.
I just want to go over a few things with you, okay? You mentioned your diets. You eat a lot of fast food, being a truck driver. You know, I know sometimes it's a quick meal to have with not much time since you're on the road a lot. But try to eat a little bit healthier, you know, pack your own meal sometimes.
Okay.
You know, that would help, you know, alleviate some of the problems with your increased weight. Sometimes, you know, that would just overall make you feel a little bit better.
Okay.
Also, increase your activity. I know it hurts to move, you know, but the more you move, you know, the healthier your body will be too.
Okay.
What I think you have is the same thing that your father has. I believe you have a little bit of arthritis going on, okay? So, you know, keep moving those joints. I can give you some medication for that to help with the side effects, with the symptoms. If you have any side effects from the medications, please let me know.
Okay.
To follow up, and, you know, we can evaluate that. Do you have any questions for me at all?
No.
No? Okay. If you do think of some, please feel free to call the office. Okay?
Okay.
All right. Thank you so much.
Thank you.